Hello, I'm Dr. Ruth Roberts, your pet's ally, coming to you live today, or not live, but recorded from beautiful Keystone, Colorado. Today I'm going to talk about a pain support protocol I've developed and used over the years, and also answer some questions that you all have sent in. And if you'd like to submit a question about your pet, the easiest way to do that is to message me here on the Facebook page, or go to our website, drruthroberts.com, and on the home page, hit that button that says Ask Dr. Ruth, and we'll get you an answer on our next recorded video or on our next live. So a couple of things I wanted to share with you. One is somebody that's in our croc pet community sent me a question about this fellow's blog, and you may or may not have seen it. The thing that I find interesting is that I have to actually agree in this case. So SkeptaVet is a veterinarian, and I don't believe he or she says who they are on the blog itself, but what they typically have a very dim view of alternative medicine and things of that nature. And you know, if you can look down here at the sidebar, you know, holistic vets, more nonsense from holistic vets about on commercial diets and that kind of stuff. So, you know, clearly he's got a very conventional approach to nutrition, but you know, this particular blog post I have to agree with. So what he's saying is that pet owners frequently project their beliefs about human health onto their companion animals. So you know, the whole thing with the anti-vaxxers, that sort of stuff, and then the projection of human dietary practices. And so I have to agree, vegetarian and vegan diets for dogs and cats are just not a fantastic idea, particularly for cats who are obligate carnivores. Dogs are more omnivores, and so we can get away with these types of diets a little bit better, but I frankly see a great deal of liver enzyme elevation on the diets, and so I just really cannot recommend them. But I'll put the link to this recording below for you to check out. But you know, but what he's saying makes a great deal of sense. And in fact, in light of a study that discussed you know, people getting away from heavily processed diets, it didn't, you know, what they found was that the heavily processed diet in and of itself is what made you want to eat more junk food. So it doesn't matter what your dietary preference is, whether it's vegetarian, vegan, paleo, keto, whatever it is. It's that you're eating more whole foods and eating much less highly processed pro-inflammatory foods. So I find that to be a really amazing way to help improve pets' health as well. So having said that, I'm going to jump into the pain support protocol. And if you're not a member of our free members area, you know, go do that. It's simple. There's several health protocols, holistic health protocols based on different disease conditions. And, you know, it's just a super quick way to get good information, get access to what supplements I found to actually work well. So first up, as I just mentioned to you, is, you know, if you're not cooking, start, because a whole food diet is anti-inflammatory. It's going to help everything function better and probably also help your pet maintain a normal body weight as well. So if you're not cooking, get on it. You know, you can make an argument for raw versus cooked. Again, the reason I recommend cooked diet is for two things. If your pet's already elderly and somewhat sick, its digestion is not fantastic. And so if you try to throw raw food down in there, that can often end disastrously. And the second is, frankly, sustainability. You know, dogs and cats are eating somewhere between 25 and 30% of the protein, meaning animal protein produced in this country already. If we convert more of them to raw food, that's gonna, we're gonna hit 40 and 50% of the protein produced in this country going to pets, and that's simply not sustainable, and it worsens our greenhouse gas production as well. So that's my short line on cooking. So get going. If you're not a crock pot cook, come on in and we'll help you out in our private Facebook community as well. So the other things that are on this protocol are things that are going to reduce inflammation, and by reducing inflammation, we're going to reduce pain. So ArthroSoothe is one of the kitchen sink's joint supplements. It's kind of got everything you possibly could need as far as improving inflammation. So trace minerals, glucosamine, MSM, green lip mussel. Cetyl myristilate is an interesting product, and it has been shown to really help improve function in arthritic pets, as well as hyaluronic acid. I found that to be tremendously helpful. There's another product I've used for years called ArthroEase Gold, and I do like that one. But it is chicken based, and so for pets that are food sensitive, it's not a great choice. This one is shellfish based, and so most pets can tolerate that really well, even if they've got some significant food sensitivities. Omega-3 fatty acids at high doses are going to be a great anti-inflammatory, and then probiotics, I mean, golly, they're just so versatile, but again, the concept is that if we keep the immune system functioning well, then we're going to allow that pet to produce more anti-inflammatory molecules versus pro-inflammatory molecules. Now, two other things you may not be familiar with. One, Invigorate the Collaterals is a traditional Chinese herbal formula that's used to resolve stagnation and move blood. So in traditional Chinese medicine, stagnation is pain. It's also cancer, so we'll use this in many cancer patients as well. But the point of this formula is to get things moving again. So, and if you're getting older and stiff like I am, you know what I'm talking about. You do something and you go to get up and it's like, oh golly, what did I do? So this helps to resolve some of that stagnation. Now, the other thing that's on this page is marine collagen. So again, collagen protein is fabulous for helping to maintain muscle and get things moving. And again, this is a hypoallergenic type formula. Much of the collagen sources out there are either chicken or beef. And so again, if your pet has sensitivities to that, not a great idea. Now, the deal with collagen is it's sort of the building block for most of the musculoskeletal system. And in older pets, if we provide them with slightly more protein, and in this case, very targeted amino acids to help maintain muscle, they maintain stability, strength, and mobility. So that's kind of what it's all about, right? So that's the page here. You can submit a question. You can buy the whole protocol and save 10% off the whole deal. Coaching program. And then the other thing coming will be the mobility masterclass that Michael Daly and I did together, and I'll get that in on this page. But essentially what Michael did was work through several massage techniques that you can do at home to help improve your pet's mobility and decrease its discomfort. So that is coming soon to this page. Now, as I said, we had several questions. And by the way, Michael, if you are in the Las Vegas area, Michael will be there August 10th to the 12th. And so I'll put his Facebook link down in the comments below as well. If your pet is really stiff, this is a fantastic way to kind of help get things moving again. And Michael is hoping to be back in the Vegas area with some frequency. So the first question I've got is from Jana Murray, and she's asking about her pup Prissy, who's an older lady, so she's somewhere between 10 and 15 years old. And she's had ongoing infections, false pregnancy every heat season. She's not currently spayed. She was adopted at 9, and her skin has become black, and she's lost her beautiful coat, and she's really, really itchy. So, Jana, there's several things that can be going on here, and I'm not sure how long the itchiness and that sort of stuff has been happening, but what likely is more at issue is if she's had multiple false pregnancies, and you don't mention if the infections are in the skin or uterine infections, there's a good chance she could be harboring something called a pyometra, which is an infection of the uterus. And this would be a reason to strongly consider spaying her. If her skin has become black and her coat's gotten really just sort of blown out and she's super itchy, the other thing that may be going on is she may be hypothyroid, meaning low thyroid function. So I'd talk with that about your vet. I mean, your vet's the person that can help you out the best here, but this is a situation where I would consider spaying simply because her risk of developing an infection of the uterus gets greater and greater. And if she's harboring an infection in there that never quite goes away, it's going to create systemic inflammation that's going to create issues with her skin. So I hope that's helpful, Jana. Linda Behrman's asking about her kitty Roxy, who is fairly young, so 2 to 5 years old. And Roxy, Linda's saying that Roxy has a bacterial feline leukemia, which doesn't quite make sense. Leukemia is a viral infection, and she's low on iron, and she's giving her, I think, CBD oil, and it's helped, but she's looking for something more. So one of the things that feline leukemia can do is create an anemia, which is a low red blood cell count. And so sometimes if that's what's going on, sometimes by giving iron injections, B12 injections, things of that nature, we can really help improve the red cell count. The other thing you want to do certainly is to support her immune system so that she is able to keep the virus better under control. And, you know, I think, Linda, if you head over to the Keep My Pet Healthy protocol, that's a fantastic way to start, and it may be all you need for right now. You know, so get on a anti-inflammatory diet, use probiotics and fish oil to help reduce inflammation. The next question is from Gail, and she is asking about her kitty Jake, who's a mixed possible Bombay kitty. And he's been diagnosed with FLUTD, which is the feline lower urinary tract disease. And he had extra protein and crystals in his urine. He was very upset over a loss of a friend of his possum. And my son's teen attitude, that's a teenager in the house is enough to stress everybody out. My vet wants to put him on Royal Canin pet food, but she doesn't think that's the best food for him. And right on, Gail. So, you know, if you're not already feeding a canned food, that's the first step, is to convert Jake from a dry food to a canned food. That's going to help alleviate many of the symptoms of the urinary tract disease. And then ideally you would go from canned to cooked food. And by adding extra moisture in the food, you're going to dilute out the urine and help again reduce symptoms. So FLUTD often is due to stress and anxiety. So Gail, you might check out my anxiety support protocol and see if that isn't of help to you. So hopefully Jake will feel better, but right on, the commercial pet food is not the best option because that's going to simply increase his inflammation level all the time. Now, the last question I've got for you today is from Liza Pisana, and it's about her dog Lexi, who is a 2 to 5 year old Yorkie, and she is itchy all the time and she's constantly scratching. She's tried different shampoos and changed her food and put coconut oil on her, but doesn't seem to really be getting anywhere. So, Lisa, I think this is where you need to think about, when did Lexi start itching? Was it immediately after she got spayed? Was it after a move? Things of that nature. And that's going to kind of help you narrow in on what may be causing this. She's at that age range where being hypothyroid could be contributing. allergies certainly, food sensitivities, so there's a whole host of different things that could be going on here. If you feel like this is an allergy, I think this is where the Glacier Peaks life stress scan test can be very helpful as far as determining a roadmap to get you started on figuring out, okay, what do we need to take out, what do we need to leave in? And then from there you can really build a nice hypoallergenic diet based on what you think is going to best serve her. So I hope that's of help to you. Again, if you would like to submit a question about your pet's health and get some holistic guidance on that, message me right here on the page, or go over to the website, drruthroberts.com, and click that Ask Dr. Ruth button and fill in the little form, and we'll get back to you and let you know when your question will be answered. So until next week, remember, your pet's best health starts in the bowl. I'm Dr. Ruth Roberts, your pet's ally.